Welcome to Meteorology Matters, the show where we take a deep dive into something that really impacts us far more profoundly than we often realize. We're talking about the hidden human toll of powerful atmospheric events. Today, we're actually taking a look at some groundbreaking new research. It reveals how tropical cyclones, hurricanes, typhoons, how they can have this lasting, often invisible effect on our health and mortality. An effect that stretches far beyond the immediate devastation we see on the news. This is your Meteorology Matters podcast.
It's so true. Our minds, they often go straight to the immediate damage, don't they? And the tragic, highly visible, direct fatalities when a major storm hits. But the latest insights from the world of science, they paint a much broader and frankly, maybe a more unsettling picture of human vulnerability and also long-term resilience, especially as our global weather patterns continue to shift and, well, intensify.
Yeah, exactly. And as always, being well informed about these complex forces it's absolutely critical. The insights we're about to share are powered by the incredible work of meteorologists and researchers worldwide. And, to connect with a leading voice in this field, meteorologist Rob Jones, you can follow him on Instagram at meteorologist_guy_bull, find him on TikTok at TV Meteorologist, and search for Rob Jones Hurricane on YouTube. That's also where you can find the Meteorology Matters podcast playlist. He's doing some really invaluable work bringing this crucial science to everyone, and his platforms are just a fantastic resource for staying updated.
So, yeah, prepare for your understanding of disaster impact to be completely reshaped. We're going to explore how these storms leave a legacy that extends far, far beyond the initial news cycles. It really gets into the quiet corners of public health.
All right, let's unpack this then. When a tropical cyclone makes landfall, what's the first thing that usually dominates our headlines? It's the direct, acute impacts, isn't it? We see those images, collapsed buildings, immediate casualties, the dramatic rescues. But what the latest studies are revealing is that this picture it's far more complex, even in the immediate aftermath. Our traditional way of counting storm fatalities, it's been remarkably narrow, and that's a perspective that seems to be changing very rapidly now.
What's truly fascinating here is how the data uncovers a significant ripple effect on mortality, one that begins to manifest even within weeks of an event. And this goes well beyond the immediate physical consequences that emergency responders typically count on the ground. Historically, our assessment of deaths from tropical cyclones has largely focused on these direct deaths. So fatalities from physical injuries, drowning, electrocution, or maybe structural collapse that happen during or immediately after the storm. These are the numbers that hit the headlines, right? They shape public perception of the storm's severity, and they form the basis of official death tolls. They're the most obvious, the most visible, and therefore the ones most easily tallied up.
So we're talking about a very specific, acute type of death that's easily attributable to the storm itself. But you're saying a new wave of epidemiological research, that's the study of how diseases and health conditions spread in populations, is pushing past that. It's looking for something more subtle.
Precisely. There's a growing body of this research that's fundamentally challenging this narrow viewpoint. These newer studies suggest that the full health consequences of tropical cyclone exposure are much broader, and they encompass a significant number of what we call excess deaths. Now, these aren't necessarily deaths directly caused by injury from the storm itself. Rather, they stem from a kind of cascade of indirect factors. This points to a much deeper and often unacknowledged mortality burden on affected populations, a burden that remains largely unseen by conventional reporting and frankly, by most of the public.
That's a profound shift in how we should be thinking about these disasters. To really wrap our heads around this concept of short-term indirect deaths, let's look at some of this emerging evidence. There's a recent detailed investigation conducted in South Korea that offers some crucial insights. It acts as a kind of pioneering case study, right?
Yeah, this was indeed a pioneering study in its approach. It meticulously analyzed data from 9 specific tropical cyclones that made landfall on the Korean peninsula between 2002 and 2023. The researchers really dug deep. They pulled together government data on storm paths and used incredibly high-resolution mortality information, right down to the fine administrative unit level, which gave them an exceptionally precise picture of where and how people were impacted.
Okay, and what's particularly innovative about this study is how they managed to tackle that incredibly complex challenge of isolating the storm's unique impact from all the other things happening in a community. How did they even begin to isolate that effect in their research? It sounds really difficult.
It's an excellent question, because it's definitely not simple. To accurately gauge the effect of these events, the researchers employed a pretty sophisticated natural experimental framework. It's known as generalized synthetic control analysis. Think of it like this. For every region that was actually hit by a cyclone, they essentially built a twin region, a synthetic control region. They built this out of other administrative units that weren't exposed but closely matched the exposed region in pre-cyclone mortality trends. This innovative method provides a really robust way to isolate the cyclone's true causal effect on mortality. It minimizes the influence of other variables and gives us a much clearer understanding of its direct impact.
Ah, okay. So it's like creating a parallel universe where the storm didn't hit, but everything else was basically the same. That's a powerful research design. And what did the study find in terms of short-term impacts that went beyond just the immediate physical injuries?
Well, the results were quite revealing and a little unsettling, actually. The study uncovered statistically significant daily average increases in all-cause mortality, meaning deaths from any cause. We're talking approximately 0.084 more deaths per exposed region per day. And notably, there was a rise in non-accidental mortality, around 0.075 more deaths per exposed region during the 2 weeks immediately following tropical cyclone exposure. Now, while external injury-related mortality also saw an increase, the rise in these non-accidental deaths truly underscores a broader systemic impact on public health. It clearly shows it's not just about who gets caught in the storm's immediate fury.
Right. And when you scale those daily averages up across the affected regions, what does that look like in terms of total excess deaths for a single storm? What kind of tangible numbers are we talking about here?
Yeah, good question. When they applied these daily increases across the affected regions, the study estimated that, on average, each tropical cyclone impacting South Korea resulted in approximately 150 excess all-cause deaths. And that's just during that critical 2-week post-exposure period. This figure wasn't static, of course. It varied depending on the specific cyclone. It ranged from a low of 71 excess deaths for one event in 2007 to a high of 194 for another in 2019. It gives us a tangible number to consider, much higher than what traditional direct death counts might suggest. It's a silent, unseen death toll.
So these non-accidental deaths, it's still a bit of an enigma. How exactly are they linked to the cyclone if not by direct injury? What are the mechanisms at play that cause someone to die from, say, a heart attack 2 weeks after a storm?
Well, the increase in non-accidental deaths is primarily linked to the heightened physiological and psychological stress experienced by individuals. I mean, imagine the trauma of a storm, the uncertainty, the fear, the disruption to daily life, the loss. This profound stress can exacerbate pre-existing conditions. And coupled with this, there are often significant disruptions or delays in the availability and accessibility of essential healthcare services following a cyclone. Power outages can cripple hospitals, impassable roads can prevent ambulances from reaching people, medical facilities might be damaged, or emergency services just become completely overwhelmed. This means individuals might succumb to pre-existing conditions like heart disease, diabetes, or respiratory ailments, or even new health crises that arise indirectly from the storm, rather than from direct physical trauma. They are dying because of the storm, but not from being hit by debris or drowning, if that makes sense.
Yeah, it does. And were there particular groups that seem to be more vulnerable to these short-term effects? Does it hit everyone equally?
No, it certainly doesn't. The South Korean study precisely identified populations with heightened susceptibility. Elderly individuals, particularly those aged 65 and older. Also, populations with lower educational attainment, which often goes hand in hand with lower socioeconomic status and fewer resources. And residents living in closer proximity to the direct path of the cyclone's center. This clearly highlights crucial demographic and socioeconomic vulnerabilities that demand, really, targeted public health preparedness efforts. It reminds us that disasters don't affect everyone equally. They often exacerbate existing inequalities.
That's a powerful global perspective showing the nuances of immediate impacts. But what about here in the United States? Do we see similar patterns of undercounting and these indirect short-term deaths?
Absolutely. Turning our attention to the United States, another incredibly extensive study examined an immense data set. We're talking 40.7 million death records and a comprehensive list of 179 named tropical cyclones that affected the nation's counties between 1988 and 2019. This monumental effort allowed researchers to consistently estimate short-term, all-cause excess deaths across the entire contiguous United States over more than 3 decades. It provided a truly robust and consistent national picture.
And did this U.S. study also bring to light those, well, startling discrepancies between estimated excess mortality and officially reported death tolls, like the South Korean study hinted at? The numbers from events like Katrina and Irma are often cited as incredibly low compared to what people experienced.
Oh, it brought them to light in a very dramatic way. It showcased just how much of the human cost goes unacknowledged. For Hurricane Katrina in 2005, for example, while the official figure for this devastating event was 1,170 fatalities, the study estimated a substantially higher 1,491 excess post-tropical cyclone deaths. That's already a significant and frankly sobering difference.
But I've heard there are even more striking examples of this undercounting, with even wider gaps between the official number and the estimated excess deaths.
You're absolutely right. Perhaps even more strikingly, for Hurricane Irma in 2017, the study estimated a staggering 12,202 excess post-tropical cyclone deaths. Now, compare that to the official figure of just 97.
97, wow.
Yeah, that is an order of magnitude difference. It's a truly dramatic contrast that should make us all question how we define and count disaster fatalities. And Hurricane Sandy in 2012 also saw an estimated 11,193 excess post-tropical cyclone deaths, indicating a significant undercount compared to direct tallies. Again, it just showcases this pervasive issue of uncounted human loss.
That's a huge gap. What explains these considerable differences? It feels like we're missing so much of the true impact and the full story.
Researchers point to several interconnected reasons for these discrepancies. Official figures often focus exclusively on direct, acute injuries, missing the more complex indirect pathways we just discussed. There are also varying methodologies for attributing direct versus indirect deaths on death certificates, which can create inconsistencies and omissions in reporting.
Mhm.
And then there's the more concerning aspect, potentially bureaucratic or even politically motivated tendencies to minimize reported counts after a disaster.
Really? To control public perception, maybe?
Perhaps to control public perception or avoid more intense scrutiny, yeah. This combination of factors leads to a severe underestimation of the true human cost, and it leaves communities unprepared for the full scope of recovery needed.
Okay. So when you look at the overall short-term burden across the U.S., what's the magnitude of these excess deaths based on wind strength? Are we only talking about the big, destructive Category 5 storms, or do the weaker ones, the tropical storms, contribute significantly too?
No, not at all, just the big ones. The study concluded that for counties with a high probability of excess deaths, there were an estimated 3,112 excess deaths following hurricane-force winds. But here's the critical part, often overlooked. A staggering 15,590 excess deaths occurred after gale to violent storm-force winds.
15,000 from non-hurricane strength storms.
Yes. This indicates that even less intense but more frequent storms contribute significantly to the overall short-term mortality burden. It's not just the monster hurricanes that dominate the headlines. It's the cumulative effect of many smaller but still impactful storms that add up to a substantial and often silent toll on public health.
And is this a problem that's staying relatively constant over time, or is it getting worse? Are we seeing an escalating challenge?
Well, there's a concerning and undeniable trend in the data. A significant proportion of these estimated excess deaths, over 72%, occurred in the latter half of the study period, specifically from 2004 to 2019. This trend might reflect a genuine increase in impact, or perhaps improved detection methods in research, or, maybe a combination of both. Regardless of the exact weighting of those factors, it highlights an escalating challenge in terms of the human toll. It suggests that the problem is not static, but growing.
Can you give us some specific examples of where this short-term burden is most concentrated at the county and state levels? Where are these hot spots of excess mortality where communities are really feeling this impact most severely?
Certainly. The analysis identified specific geographic areas bearing a heavy short-term burden. For instance, Orleans Parish, Louisiana, experienced 719 excess deaths after Hurricane Katrina in 2005. That made it the largest annual county-level excess death count in the study. Harris County, Texas, recorded 309 excess deaths after Hurricane Rita in 2005. And Broward County, Florida, saw a 185 after Hurricane Matthew in 2016. On a broader scale, certain states consistently ranked high in annual excess deaths. Florida, especially in 2017, with 1,403 estimated excess deaths. Louisiana, with 1,238 in 2005. Texas, 502 in 2005, and Georgia as well. This clearly highlights the concentrated impact along the Atlantic and Gulf coasts where tropical cyclones are most prevalent and the populations are consistently exposed.
We've peeled back the layers on the immediate impacts, revealing this hidden toll in the weeks after a storm. But as I dove deeper into these findings, what genuinely startled me was the idea that a storm's shadow might stretch not for weeks, but for years. It forces us to ask, what does recovery even mean if the effects linger for a decade and a half?
You're touching on what is perhaps the most profound revelation in this area of study. If we connect this to the bigger picture, the persistent influence of these events reveals a hidden burden on public health that has largely gone unquantified and, frankly, unrecognized until now. A deeply comprehensive study, quite distinct from the short-term analyses we just discussed, focused on the contiguous United States from 1930 to 2015. It scrutinized the long-term effects of tropical cyclones on human mortality.
Okay, 1930 to 2015, that's a long time frame. And what did this groundbreaking long-term perspective actually reveal? How long can the effects of a single storm truly linger on human health and mortality?
This pioneering research uncovered a startling and previously unrecognized phenomenon. The mortality impact of a single tropical cyclone can persist for an astonishing period of up to 15 years. 15 years, yes, or 172 months after the physical event. This finding profoundly challenges the conventional understanding that the major impacts of these disasters are short-lived and confined to the immediate aftermath. We're talking about an influence that spanned almost an entire generation, subtly but significantly altering health trajectories for hundreds of thousands of people.
15 years? Wait, so an average storm, the kind we usually hear about, causing maybe a couple dozen immediate direct deaths. That storm is actually responsible for thousands more deaths over a decade and a half. That completely flips our understanding of disaster impact on its head. It's not just a statistic, it's like a silent, ongoing crisis.
It absolutely does. The study estimated that the average tropical cyclone striking the contiguous United States caused between 7,000 and 11,000 excess deaths over this extended 15-year period. Now, to grasp the scale of this, consider that this figure vastly overshadows the average of just 24 immediate direct deaths, typically reported by the National Oceanic and Atmospheric Administration for the same storms.
24 versus potentially 11,000.
Exactly. We're talking about a difference of hundreds of times the initial reported fatalities. It reveals an enormous and previously invisible human cost.
This isn't just a few additional deaths. This sounds like an unacknowledged national burden on almost unimaginable scale. What's the cumulative effect of all storms over that nearly century-long period they studied?
The cumulative effect is indeed staggering. All 501 tropical cyclones that affected the contiguous United States between 1930 and 2015 resulted in a colossal estimated total of 3.6 to 5.7 million excess deaths.
Million,
yes, 3.6 to 5.7 million. This means that the long-term influence of the tropical cyclone climate, a factor often completely overlooked in public health assessments, contributed to a substantial fraction between 3.2% and 5.1% of all deaths across the contiguous United States during this period.
Wow.
To provide truly striking context, this hidden burden accounts for more deaths than all motor vehicle accidents, which total about 2.0 million, or infectious diseases at 1.9 million, or even U.S. battle deaths in wars, which amount to 1.3 million, combined over comparable timeframes within the study period.
That puts it into perspective. It truly redefines the scale of impact these storms have on our society.
It really does.
So these long-term excess deaths are overwhelmingly not from direct injuries, right? They're classified as indirect. Can you give us a clearer picture of the nature of these indirect deaths and the complex chain of events that leads to them years, even a decade or more later?
You're absolutely right. These deaths are not due to direct physical trauma from the storm itself. Instead, they are triggered by complex and often subtle sequences of events that unfold in the wake of tropical cyclones. For example, consider economic loss, post-storm economic hardship like job loss, business failures, or maybe the depletion of retirement savings just to repair property damage. This can severely reduce future spending on critical health care. This can mean delaying necessary doctor's visits, foregoing essential medication, or simply not being able to afford nutritious food for years, all of which kind of chips away at health over time.
And what about social structures? Can the social fabric of a community be affected in a way that leads to long-term health consequences, even if the physical damage is eventually repaired?
Yes, absolutely. Disrupted social networks play a significant role. The aftermath of a tropical cyclone can trigger significant social changes. This includes the outmigration of working-age individuals or key family members from affected areas. This loss of social capital and vital support can severely impact the long-term health and well-being of older adults or other vulnerable dependents who remain. Imagine an elderly person who relied on family for transportation to appointments or maybe help with daily tasks. If that support system moves away, their health can decline over time, leading to adverse outcomes years later simply due to a lack of that support.
And it's not just individuals or families, right? Governments also have to make tough choices after a disaster, which can have ripple effects on public services down the line.
That's a critical point. Governmental fiscal adjustments are another factor. In the face of immense immediate recovery costs, state and local governments may be compelled to restructure their budgets and reallocate funds. This could potentially lead to reduced long-term investments in vital public health infrastructure, healthcare services, or social programs that are crucial for maintaining community health. When resources are stretched thin for immediate emergency response, long-term public health initiatives can quietly suffer, impacting the health of populations for years to come.
And the environment itself, even after the immediate cleanup, can still pose a lingering threat, can't it?
Indeed. Persistent environmental changes are a significant consideration. Tropical cyclones can cause lasting alterations to the natural environment. This might include changes in ecological conditions that redistribute disease vectors. Think of stagnant water leading to increased mosquito populations carrying illnesses, or prolonged exposure to harmful chemicals and pollutants from flooded areas. These can lead to chronic health issues like respiratory problems or certain cancers over time, long after the floodwaters recede.
And finally, the sheer psychological and physical toll. I mean, experiencing such an event must have a lasting impact. We know stress affects health, but over a decade and a half.
The profound and prolonged physical and mental stress of experiencing a tropical cyclone and its complex aftermath, the trauma, the displacement, the financial insecurity, the uncertainty, it can have deep and enduring effects on long-run health. This sustained, chronic stress can exacerbate pre-existing conditions or lead to new ones, from cardiovascular issues to severe mental health disorders. It ultimately contributes to changes in long-run mortality trajectories. It's almost like a slow-motion disaster playing out within individuals and communities.
And there was a particularly telling example related to infant mortality in the study. Wasn't there something that really highlighted this indirect delayed impact?
Yes, it's a sobering detail. The study found that a striking 99% of excess deaths among infants occurred more than 21 months after the tropical cyclone.
21 months, almost 2 years later.
Exactly. This powerfully suggests that these fatalities were due to these indirect cascades of effects, the long-term stress on families, economic hardship, disrupted services, rather than direct exposure to the physical event at landfall. This is powerful evidence that the storm's legacy extends far beyond what is immediately visible or traditionally counted.
So who exactly is bearing the greatest long-term burden from these powerful storms? Does it affect everyone equally, or are there specific groups that are disproportionately vulnerable over this long haul?
The long-term study meticulously evaluated the effects across different age categories, revealing a pretty nuanced picture of vulnerability. While older populations, those aged 65 and older, numerically account for the largest number of total excess deaths, about 46% of the total. This is primarily due to their higher baseline mortality rates, just generally speaking. However, the relative risk of excess mortality following a tropical cyclone is disproportionately highest for infants, those under 1 year of age.
Okay, so while the absolute numbers are higher for the elderly, the storm accounts for a much larger proportion of deaths in the very young. That's a critical distinction to make.
Exactly. For infants, the cumulative excess mortality risk was estimated at 49.8 deaths per 100,000 population per unit of wind speed. That's followed by individuals aged 1 to 44 years. This means tropical cyclones explain a substantial fraction of overall mortality in these younger groups. We're talking approximately 25% of all infant mortality and 15% of all deaths for those aged 1 to 44 in affected areas can be traced back to the tropical cyclone climate.
Wow, a quarter of infant deaths.
Yeah. The remaining proportion of total excess deaths linked to tropical cyclones includes 32% for ages 1 to 44 and 8% for ages 45 to 64. This breakdown underscores that while the elderly are numerically most impacted, the proportional risk and the impact on life years lost are significantly higher for the youngest populations.
That's a profound finding about the vulnerability of the very youngest among us. What about racial disparities? Does this long-term burden fall differently on different racial groups in the U.S.?
Yes, the study uncovered a profound racial disparity in long-term mortality risk. When both Black and white populations were exposed to the same tropical cyclone event, Black individuals experienced a significantly higher cumulative excess mortality risk. It was about 13.53 deaths per 100,000 per unit of wind speed, compared to white individuals, who experienced 4.19 deaths per 100,000 per unit of wind speed over that 1 in 72-month period.
So Black communities are disproportionately affected even when experiencing the same physical storm intensity. This points to underlying pre-existing vulnerabilities, doesn't it?
Precisely. Although the white population exposed to tropical cyclones is larger, leading to about 66% of cumulative excess deaths occurring among white individuals. The 34% occurring among black individuals represents a disproportionately larger burden relative to their population size. This disparity is attributed not only to inherent vulnerabilities within black communities, things like socioeconomic factors, historical disinvestment, limited access to resources, but also to their denser spatial distribution in the southeastern United States, an area highly prone to tropical cyclones. Annually, an estimated 37,402 excess deaths among black populations in the contiguous U.S. are traceable to prior tropical cyclones. That constitutes 15.6% of all black mortality, which is in stark contrast to 3.1% for white populations. It paints a very clear picture of unequal impact.
Yeah, that's incredibly stark. So when researchers tried to pin down the official causes of these long-term indirect deaths, these fatalities that happen years later, what did they find? Were there specific diseases or conditions that stood out, or was it a broader, more diffuse picture?
Well, when researchers examined the official causes, they found that the largest proportion, nearly 59%, fell into a broad, non-specific other category.
Other. That sounds vague.
It is. This category includes conditions such as diabetes, suicide, and even sudden infant death syndrome. It makes it challenging to pinpoint a single clear link back to the storm without further, incredibly detailed investigation into individual cases or mechanisms. Cardiovascular disease accounted for the second largest share at 36%, and neoplasms, various forms of cancer, for about 11.6%. It's important to note that infectious diseases, respiratory diseases, and motor vehicle accidents were not statistically linked to long-term tropical cyclone excess mortality. This further emphasizes the complex indirect pathways that truly drive these fatalities, often through things like chronic stress or delayed healthcare access.
Okay. And geographically, where is this long-term burden most concentrated in the U.S.? And does regular exposure to cyclones make communities more resilient, or is there maybe a limit to how much we can actually adapt?
The study confirmed that southeastern states bear the highest proportion of total deaths attributable to the tropical cyclone climate. For example, 13% of all deaths in Florida, 11% in North Carolina, 9% in South Carolina, and 8% in Louisiana during the study period could be traced back to their state's tropical cyclone climate. Interestingly, though, states that experience tropical cyclones less frequently demonstrated higher vulnerability to these events. The mortality impact of physically similar tropical cyclone events was found to be approximately 2.8 times greater in these infrequently affected states compared to those where tropical cyclones are a regular occurrence.
Huh. That makes intuitive sense, I suppose. You'd think that repeated exposure would lead to better preparedness, stronger infrastructure, maybe a more ingrained culture of resilience.
It does suggest that populations do adapt to regular exposure, likely through improved infrastructure, better preparedness efforts, more robust response systems that are regularly tested and refined. However, the research also indicates that there appears to be a limit to how effective these adaptations are in fully offsetting the overall mortality burden. Vulnerabilities persisted even in frequently exposed regions. It suggests it's a continuous battle against a persistent threat, not a problem that can be entirely solved with adaptation alone. This raises a really important question, doesn't it? If these impacts are so extensive and long-lasting, covering years and impacting millions, why haven't we fully recognized them before? And what does the future hold for how we deal with these powerful weather events? What does this mean for our collective future?
Precisely. So what does this all mean for how we prepare for and respond to these atmospheric forces in the years to come? You mentioned the long-term analysis revealed a significant and concerning acceleration in tropical cyclone-driven mortality in the contiguous U.S. after the year 2001. That's a recent and, yeah, alarming shift.
Yes, the numbers really jump out. Prior to 2001, tropical cyclone-related excess deaths increased by an average of about 9.2 deaths per month across the contiguous United States. However, after 2001, this rate jumped dramatically to an average of approximately 43.3 excess deaths per month.
Wow, that's a nearly five-fold increase.
It is a substantial and alarming acceleration of the human toll.
So what's driving this acceleration? Is it simply stronger storms hitting us more often, like maybe climate change-related intensification, or is it something else entirely?
Well, researchers meticulously decomposed this accelerating trend to identify its primary drivers, and the findings are quite counterintuitive and really crucial for policy. The acceleration is primarily attributable to a higher frequency of tropical cyclones after 2001, an average of 17 per year compared to the period before 2001, which saw about 14 per year. Now, crucially, the maximum intensity of state-level wind speeds from these landfalling storms actually declined slightly on average after 2001.
Declined.
Slightly, yes. This means it's the sheer number of events, rather than individually stronger storms, that is primarily driving the increased mortality burden. More frequent storms, even if slightly weaker on average, are having a greater cumulative effect over time. That's a vital distinction. So it's about quantity, not just intensity in this specific trend. But you also mentioned something about population dynamics being the overwhelming factor here. That seems like an enormous piece of this puzzle.
This is perhaps the most profound finding regarding the accelerating trend. When researchers quantified the contributions of various factors, they found that climatological factors, changes in tropical cyclone frequency or intensity, contributed only about 12% to the overall trend in increased mortality burden.
Only 12%.
Only 12%. And population shifts towards coastal areas, which is often hypothesized as a major driver of increased disaster impact, accounted for a comparatively small 7.5% of the trend.
The overwhelming majority of the increase, a staggering 80.5% of the tropical cyclone-related mortality, resulted from the simple yet profound growth and aging of the contiguous United States population over the study period. This demographic shift means more people, and particularly more vulnerable older adults, are simply living in areas exposed to tropical cyclones. That fundamentally escalates the human cost, regardless of storm intensity or coastal migration patterns alone.
That's a huge piece of the puzzle, and one that forces us to look inward at our own societal changes, not just outward at the weather. So the why behind these indirect deaths, it still remains somewhat of an enigma, doesn't it? The studies conclusively demonstrate that tropical cyclones cause substantial excess mortality, especially in the long term. But they don't explicitly pinpoint the exact underlying mechanisms. It's like knowing something is making people sick, but not yet understanding the full biological or societal disease process itself.
Exactly. This situation is very much akin to early scientific discoveries that linked hazards like tobacco or asbestos to severe health outcomes long before the specific biological and physiological mechanisms were fully understood. We have the strong correlation and the profound impact, but the precise causality pathways are complex and multifaceted. They require more focused, interdisciplinary research.
So even though we don't have definitive answers for every single pathway, researchers have put forth several compelling hypotheses to explain these complex and often delayed effects, right? Giving us a crucial roadmap for future investigation. What are some of those leading ideas for how these indirect deaths occur?
Well, one major hypothesis revolves around economic disruption and prolonged financial strain. Tropical cyclones can lead to severe economic losses at both the individual household level and broader macroeconomic levels. This disruption might force families to divert crucial financial resources, like retirement savings or emergency funds, towards immediate property repairs or recovery, and that reduces future spending on essential healthcare. Job losses, disruptions to income streams. They can also impact health insurance coverage and access to medical care for years. It forces people to make really difficult choices between food, housing, and their health.
And beyond money, what about the human element, the social fabric of communities? How can that be impacted over the long term?
Disrupted social networks are another key hypothesis, yeah. The traumatic aftermath of a tropical cyclone can trigger significant social changes, including that outmigration of working-age individuals or key family members from affected areas. This loss of social capital and vital support can severely impact the long-term health and well-being of older adults or other vulnerable dependents who remain in the community. It leads to isolation, reduced access to informal care, and unmet needs that gradually erode their health over time.
And we touched on this earlier, but governmental fiscal adjustments must also play a role beyond just immediate relief efforts. When a state budget is hit hard by recovery costs, how does that translate into long-term health impacts for the population?
Absolutely. It's a profound systemic issue. In the face of immense immediate recovery costs, state and local governments may be compelled to restructure their budgets. They have to make difficult decisions about where to cut or reallocate funds. This could potentially lead to reduced long-term investments in vital public health infrastructure, healthcare services, or social programs that are crucial for maintaining community health. When resources are stretched thin for emergency response, long-term public health initiatives like chronic disease prevention, mental health support, or environmental monitoring can suffer. And that impacts populations for years to come without anyone necessarily connecting it back to the original storm.
And environmental factors, even after the storm has passed and things appear to be cleaned up, can still continue to affect health down the road.
Yes. Persistent environmental changes are a significant consideration, often silently contributing to health burdens. Tropical cyclones can cause lasting alterations to the natural environment. This might include changes in ecological conditions that redistribute disease vectors, leading to outbreaks of illnesses like West Nile virus or Zika in subsequent seasons, or prolonged exposure to harmful chemicals and pollutants from flooded industrial areas or overwhelmed sewage systems. These can lead to chronic health issues like respiratory problems, neurological conditions, or certain cancers over time, long after the immediate floodwaters recede.
And finally, the sheer psychological and physical toll of experiencing such an event must have a lasting impact that goes beyond just the immediate trauma. It seems obvious, but maybe understated.
Indeed, this is a major factor. The cumulative and prolonged physical and mental stress of experiencing a tropical cyclone, the trauma of evacuation or displacement, the constant financial insecurity, the profound uncertainty about rebuilding a life and home. It can have deep and enduring effects on long-run health. This sustained chronic stress can exacerbate pre-existing conditions, from cardiovascular issues and autoimmune disorders to severe mental health disorders. It ultimately contributes to changes in long-run mortality trajectories. It's a silent, persistent weight that many carry for years, often without realizing its connection to the storm.
So understanding how these indirect deaths occur, the precise interplay of all these complex mechanisms, is truly the next frontier for us to move beyond knowing that it happens.
Exactly. Pinpointing the precise combination and interplay of these mechanisms is critical. Understanding how these indirect deaths occur is the next frontier. It's necessary for developing targeted, effective policy interventions that can truly mitigate this profound human toll and address the silent, lasting impact of these storms. We need to move from knowing that it happens to understanding why it happens so we can actually try to stop it.
These profound findings fundamentally redefine what constitutes a disaster. It's no longer just about the wind and the rain or the immediate physical damage we see on TV. It means we have to rethink our entire approach to preparedness and policy. It's a completely different lens we need to use.
They absolutely do. These findings underscore that focusing solely on immediate physical damage or the direct fatalities from high-intensity hurricane-force winds misses a substantial long-term portion of the human cost. And critically, non-hurricane-force tropical cyclones, which occur with greater frequency, are collectively associated with a larger total number of excess deaths. This makes them a significant, often underappreciated public health concern that demands just as much attention as the major named hurricanes.
And the research unequivocally demonstrates that we need to prepare for tropical cyclones by explicitly accounting for the deep-seated social vulnerability within exposed communities, right? It's not just about building stronger levees or seawalls, it's about the people.
Yes, that's an absolute imperative. The studies show that the most socially vulnerable populations, including those in lower socioeconomic strata with less education or certain racial and ethnic minority groups, bear a disproportionately greater burden of both short-term and long-term excess mortality. Factors like limited access to adequate transportation for evacuation, insufficient financial resources for recovery, challenges in receiving timely warnings, and existing health disparities. They all compound this already elevated risk, creating a cruel cycle of vulnerability that needs to be consciously broken through policy and community action.
And it seems like we haven't adapted to these long-term impacts as a society, not in the same way we've adapted to other environmental challenges like heat waves, for example. That's a fascinating and concerning insight.
That's a keen observation. Unlike phenomena such as heat-related mortality, where populations have demonstrated some degree of autonomous adaptation over time, for example, through the widespread adoption of air conditioning or public cooling centers, there is no evidence that similar widespread automatic societal adaptations have significantly reduced overall tropical cyclone-related mortality over the decades studied. This suggests that the indirect, often invisible, and delayed nature of these deaths has made it incredibly difficult for communities to recognize the full scope of the problem, and thus develop analogous, effective adaptations independently. The problem remains hidden, and so do the most effective solutions.
This all points to a clear and urgent public health imperative, doesn't it? We have profound knowledge now that critical healthcare needs of cyclone-affected populations are simply not being fully addressed, and that many affected individuals may not even realize how much their health has been impacted by a past storm, maybe years ago. What does this new understanding mean for the actions we must take?
It necessitates a multifaceted approach, moving far beyond our traditional disaster response models. First, we need broader mortality reporting. We need to shift our focus beyond solely reporting injury-related deaths to include non-accidental and long-term excess mortality in official counts and public understanding. Second, implementing educational programs and policy measures specifically tailored to protect and support vulnerable populations, Addressing their unique risks and systemic disadvantages is absolutely crucial. And finally, fostering deep trust in and widespread awareness of tropical cyclone warnings, coupled with ensuring that communities have the practical capacity, whether through resources, robust infrastructure, or strong social support networks to act effectively on those warnings, is paramount. It's about building resilience that accounts for the full, complex, and long-term human cost, not just the immediate aftermath.
Wow. What we've explored today truly reshapes our understanding of tropical cyclones. It's not just about the wind and the rain in the moment. It's about a silent, long-term impact on health and well-being that can stretch for years, even decades, and it disproportionately affects the most vulnerable among us.
These findings compel us to look beyond visible destruction and recognize the profound, often hidden human toll these events take. It's a powerful call to action for public health and community resilience, urging us to redefine what truly constitutes disaster recovery.
And this raises a really powerful question for all of us listening. If we now understand that these powerful atmospheric events leave a health footprint for up to 15 years, and that our societal structures, our demographics, our inequalities actually exacerbate this toll, what fundamental transformative shifts in policy and community resilience are we truly ready to make to protect the most vulnerable among us?
It's definitely an ongoing conversation, and staying connected to the latest meteorological insights is crucial for truly understanding and addressing this evolving challenge.
Absolutely. To continue learning and to follow the vital work in this field, we highly recommend connecting with meteorologist Rob Jones. You can find him on Instagram as meteorologist, on TikTok as TV meteorologist, and search for Rob Jones Hurricane on YouTube. That's also where you can find the Meteorology Matters podcast playlist. Thank you so much for joining us for this deep dive into the hidden toll of storms.